Today we have the incredible privilege of meeting with Dr. Pavitra Kotini-Shah. Dr. Kotini-Shah has the incredibly impressive resume. Welcome to HeartTalk. So excited
Thank
you're
you.
here
It's
with us.
an honor to be here.
I understand you might have a personal connection to the industry of cardiovascular care. Would you be interested in sharing that with us?
Sure. I do. An unexpected kind of personal connection. At the age of 4.5, we unexpectedly found out, literally my husband and I were at the Honda dealership when we got the call that our son needed to come into the hospital right away, and he was found to have a massive, what's called atrial septal defect and a partial anomalous pulmonary vein that needed to be rerouted. We've been sitting on this for 4.5 years and had no idea. So our world really flipped instantly, just as many patients and people and survivors and co-survivors here have shared with us, right? Like all of a sudden your life changes, your perspective changes. And so we were on that other end of being patient and family and going through open heart surgery and just seeing how vulnerable he was and how little, and it sticks with you, and you recognize how vulnerable, even as a healthcare provider.
Absolutely.
I had so many questions. I needed so much more validation from everyone really around me that everything was going to be okay, and I needed a support system. And even after this, so I reached out beforehand, talked to other groups like Little Mended Hearts to get that kind of support and stories of hope, and that everything was going to be okay. And so I think that fuels some of my passion and fuels some of my professional work to say, well, for these poor patients who have had a sudden, unexpected cardiac arrest and what their families are going through, they deserve that support and they deserve that knowledge and information so that they can process and heal.
Right.
And so that is how my son's story also influences the work I do.
So how did everything go?
He's a lovely boy, the most tender-hearted 10-year-old, huge soccer fan, but it makes me nervous. He does get still biannual screenings and follow-ups. So more reason that I need to be proactive about having emergency action plans in his school, right? Because he's an active boy, and I want to make sure him and all his friends and classmates and rest of the school is healthy and safe.
Well, thank you so much for sharing your personal story. So, can you tell us a little bit about your professional background, what you do professionally, and maybe talk a little bit about some of the research that you do?
So, I am an engineer by training, but an ER physician for my living profession.
Okay.
I also spend a lot of my time over the past several years on research. So, I've had the privilege of having a Career Development Award from the NIH that has been focused on looking at sex and gender disparities, and I focus on acute cardiovascular conditions. So I've really started to build my niche in looking at sex and gender disparities in acute cardiovascular conditions.
Yes.
And cardiac arrest is one of my most important areas I focus on. I do a lot of papers, research, data, analysis, writing, grants, but really important to go along with that, what I've recognized is the importance of advocacy, and advocacy on many levels, right? So advocacy on the community front, going out and actually being in the community, but also advocacy on with our policymakers, advocacy with our national committees, so that you can bring voice and bring kind of an urgency to the disparities that still exist and what needs to be done about it.
Okay, and how long have you been doing this kind of research?
I would say over the past 4 to 5 years, I have focused on primarily the sex and gender aspect of disparity work,
Can you speak a little bit about even 4 to 5 years ago, maybe when you started this work? One, why? Like, how did that even come on your radar as of an interest? And then what advances have you seen in this relatively short period of time?
I think one very personal thing is the fact of sometimes my own upbringing, right? Being of a South Asian descent, being born in India and coming here and assimilating, I think being a woman, it's hard within your own family, within your community.
Yes,
and so I feel like putting on my science hat, putting on my professional hat as a clinician, as a physician, I felt empowered to then be able to uplift women and through data and science. And so I really geared towards the hard data factual stuff. And now that I've become an associate professor and I feel like I'm a little bit more seasoned, I have started to appreciate then the combination of the data with the narrative and the stories, and that is a powerful combination. And we forget how important that is sometimes, and we hear so many stories of the survivors and the co-survivors and the and the why behind what everyone is doing. And so I've started to incorporate narratives more into my research, doing more qualitative research. We have, through Illinois Heart Rescue, we started back in 2016, the ICANN, which is the Illinois Cardiac Arrest Network of Survivors. So that has been like a pride and joy for myself to really connect with these just beautiful souls.
Wonderful.
Yeah.
Okay, so you mentioned a couple of things there. So for anybody who's not familiar, can you talk a little bit about Illinois Heart Rescue, who they are and what they do, and your connection to them, and then also a little bit about ICANN?
Yeah, sure. So Illinois Heart Rescue is now a state-funded quality improvement initiative that was initially funded by Medtronic Foundation through the Heart Rescue program, but then now has its own legs, funded by the state, which is amazing, which is unheard of. So we are really a shining example and getting buy-in from the political aspect in their state and really trying to improve cardiac arrest survival. Really, we have done tremendous work, and some of the work has been showcased here about how that trajectory has gone over the past 10, almost
Fabulous
10
work,
years.
really,
In terms of bystander CPR rates, survival rates, and then locally, even then at the hospital level, the improvements we've made with neurological survival. It's a fabulous quality improvement initiative. ICANN is a subgroup, kind of a offshoot under Illinois Heart Rescue that Illinois Heart Rescue supports, which is our Survivors Network, Illinois Cardiac Arrest Network of Survivors. And we have reached out to our community by EMS letters from our EMS directors who have written their names, and we've reached out to survivors through whoever we know through the CARES data that has survived a cardiac arrest, and through word of mouth we've connected with a lot of our survivors. So we're small still, but growing.
Okay.
Yeah.
And how are you received by survivors? Is there a typical response?
Typically, I feel like a common response has been, "Why didn't I know about this before?"
Okay, good.
Where were you all when I really needed
Right.
you? Because there's such a paucity of information for providers, for patients, for co-survivors, and so a lot of times these poor families and survivors are in the dark. And so when they have come across, they're like, "Oh, wow, well, finally, thank you. Like, yes, I want to come, where are you meeting next?"
So you talked a little bit about your research specifically around health equity.
Yeah.
How are we doing? How are we doing, and what are the opportunities in front of us?
Yeah. So I think strides have been made, but let's just talk about, just the bystander CPR aspect of it. There's still a lot of disparities and differences in the most up-to-date literature that's been published in the New England Journal of Medicine, right? And it still shows a lot of racial disparities in bystander CPR. Black and Hispanic patients get less bystander CPR. We know that there are gender disparities. We know that locally in Illinois that these disparities exist, and nationally. And how you break down gives you a sense of how bad that disparity is. If you look at it as an aggregate, 2%, not terrible between men and women. But if you look at truly those that are public, witnessed, cohort, And those that have had bystander CPR, women have 5 to 7% lower rates of getting bystander CPR than men.
And these are moms, wives,
Exactly.
right? Sisters, yes.
Exactly.
Okay, so you've done research in Chicago, in and around Chicago, but also India, the Middle East, really around the world. Can you talk a little bit about those research efforts and some of your biggest takeaways, what you've seen in your research and data?
I really feel that because of the strides that I think we've made in the United States and the lessons learned, there are so many parts of the world that are just getting to understand that even cardiac arrest is a thing, that there is something that could be done about it, and that it can happen even in women. And so going to Africa and going to India, I really feel fortunate to be able to bring that awareness. And then I'm received with so much amazement. I'm like, oh wow, like I had no idea. And the fact that they are eager and a very captive audience, right? They are like, tell me what I can do. What,
Wonderful.
I can do that? Like I can do bystander CPR and I'm not gonna hurt the person? Yes.
It's just so
you can.
empowering, right?
Yeah, so there's a lot of education that can be continued to be spread, and a lot of awareness that still needs to be built. And these are really communities that have starting from zero, like India's bystander CPR rate and the Paris registry was 0 to the point that they actually had to take India out in their analysis.
Based on your research,
Yeah.
as well as your educated opinion, when it comes to bystander CPR in females, there's a hesitation that contributes to less CPR actually given by bystanders, and then of course the trickle-down effect to reducing outcomes for women. Can you talk a little bit about what those hesitations are? Because I think part of the thing is having the conversation, right? About it's one thing to say it's just the numbers aren't great, but how do we talk about the why behind it and start engaging in those conversations?
Yeah, this is really important because we know that this exists. We're really going to need to get into some focus group qualitative analysis with actual community members, with actual bystanders, to really understand, well, was there a hesitancy? What was the hesitancy? What was the fear? How can we minimize that fear? A lot of the talks here have kind of asked this question, but the research hasn't been done. And so I think hopefully with our study, we'll start to add to the data and literature about some of that, answering some of that question, but the work has to be done.
Can you talk a little bit about where that came from, the origin of wanting to do this, and then to your awareness, is anybody else doing anything like this?
To my awareness, no. So I hope we don't get scooped. But honestly, this all came about because of what you all have done, right? You, as WorldPoint, have provided as the tool with the female mannequin, and that started the impetus to be like, duh, like we need to be testing and providing the literature to back up the actual research to say this is important. And so once we've had this tool in our hands just over the past year, all of these conversations have started, right? Dr. Sasan has recognized the importance of trying to capture this in a formal study. And so hence the pilot award that we've received.
Wonderful.
And so it started from you all providing us the actual tools.
And I think that, it's a great partnership because it's not just the one thing, right? It's awareness, it's the tools, it's the conversation behind it, and that where we truly address the deficits.
I mean, it's only through that process that we then normalize that there's female anatomy and that our discomfort should not supersede the life skill of saving a life. Like, there is absolutely zero reason that anybody should feel uncomfortable in trying to do bystander CPR.
As you've been engaging around the world and locally, what kind of responses are you seeing or hearing from the folks that are coming in contact with these mannequins with
Oh my gosh, yeah.
female anatomy.
I mean, it's looks of astonishment, looks of like glee and pleasure,
Wow.
and just like it gives me chills thinking about it because it's people feel heard, people feel seen, women of color, and so it's really amazing, and I feel fortunate to have experienced that firsthand.
What steps can individuals and organizations take to help their community gain better parity when it comes to healthcare equity, especially around resuscitation?
Yeah. I just think that now that we have a female mannequin around, at least addressing gender disparities, there's no reason that every single training shouldn't have a female mannequin. There is just no reason. And so I really, hope that people from this conference go back to their communities and really push, whether it's in whatever circles of influence that they're in, to ask the question, just plant that seed to be like, wait, where's our female mannequin, right? Where, it's there.
Right.
It's
Although some people
available.
say, I didn't even know they existed,
Yeah.
right?
Yeah,
Yes.
exactly. And now they can go back and tell them, hey, it exists. And so I think that's important.
What advice and recommendations would you have to help continue elevating the awareness around the issues to help improvements around health equity and the gender disparity gap? And then also maybe talk a little bit broader in the community cycles of influence and what other people can do.
I do think it is twofold. So within the professional sphere, yes, I am a physician of color, very passionate about this topic, and I have my own sphere of influence. And I've been fortunate to then be able to, do the research and talk about that research on a very scientific, cognitive manner. But then I've been fortunate because of my credentials to then be invited to Chicago Today and do a public campaign on TV about the importance of bystander CPR. But I have to say that this is something that everyone within the medical profession can and should be doing. It doesn't matter if you're an EMT or a nurse or any community social worker, whatever. I think every single one of those people within the healthcare space has influence and really can make a difference in their spheres of influence. Our community of survivors and our co-survivors, really continuing to engage with them to be advocates and champions and bringing their voices to be heard with our policymakers and at national guidelines writing committees and so forth. So there are many ways that I think we can continue to build on our innate passion that we have and build the awareness. There is a lot of work to be done, but those are opportunities. And so as you dive into this space, you recognize that the more you dive in, the more we don't know. Yes. So to not be overwhelmed by that, but to look at it as opportunities for progress and growth and expansion. So to come in with that kind of eagerness and energy.
There's still a lot of work to be done. Is there anything we're not talking about or that we need to spend more time on?
Absolutely. I really would love to see a little bit more emphasis and real brainstorming on how to address our underserved communities. That is where the starkest disparities exist. So we need to be really developing steps and actions of how do we reach out to our communities of color. Is it through our barbershops or churches? What steps are we going to take to really address things head on? So more conversation around that is certainly needed. We've heard about the importance of emergency action plans. I have a dear friend, I'm holding her accountable to it, who is the Chief Health Officer at CPS that I'm going to connect with and really push for these emergency action plans. So more conversation around that is needed locally in Chicago.
There's so many opportunities to make a difference that each one of us has, right?
Absolutely. And I think we have to be feeling empowered, and sometimes that takes a moment of quietness to connect and bring out that energy so that you are rejuvenated to go out with full force.
Wonderful. Thank you so much for joining us
Oh,
today.
thank you for having me. It's been an honor.
Absolutely.